Hello to my viewers around the globe. I'm Musa Yusuf Buhari. So, in this video, I would like to talk on the best diet that can be used to prevent the complications of diabetes mellitus. Those that are suffering from this disease condition should consume this food so as to manage their health condition and also to prevent them from uh, falling from complications that is associated with this disease, such as the heart disease and other chronic disease, kidney failure, and some problem that is related to these conditions when it becomes complicated. That is the essence of this video. So as we discussed the diabetes in my part 1 video as a carbohydrate metabolic disease, so we should need to look upon the type of the food that can be best used so as to make the person that is suffering from this condition to live long and to stay with a healthy lifespan. So when we talk of the carbohydrate as a diabetic patient, we are not going to as a diabetic patient, you are not going to cut off carbohydrates totally because some tissues in the body, such as the brain, the eyes, and the retinal of the eye or retinite of the eye, all they depends on this carbohydrate for their energy supply. And as such, you cannot you cannot cut off carbohydrate totally. There is a minimum requirement of carbohydrate that the body will also need so as to prevent the body from falling into another problem, because when you are in short or when you are in shortage supply of the carbohydrate or glucose, this can result into another problem because the body will devise an alternative way to make to drive a carbohydrate so as to operate properly, such as from the breaking down of the protein and from the lipid metabolism, which will result into ketosis and then to throw the body into accumulation of ketone bodies such as acetone, acetoacetic acid, beta hydroxybutyric acid. All these are ketone bodies. These ketone bodies, when they accumulate, they become toxic because it will disturb the acid-base balance in the blood. And normally, the acid-base balance in the blood is supposed to be maintained within the range of 7.35 to 7.45 pH levels. And if this pH is being shifted or is being altered, it will also temper with some biochemical processes that is taking place within the body. These biochemical processes, if they are being altered, so also the metabolic activities taking place in the body will also change. And as such, so you cannot totally cut off carbohydrate. As a professional, there's a level of the carbohydrate we offer to those that are suffering from that diabetes. That is why it is advisable to consult the dietitian or the nutritionist so as to know the levels of the carbohydrate intake you'll be consuming. So for the carbohydrates of those that are suffering from glucose should be using complex carbohydrate because it takes them time because it is polysaccharide. So it takes time for them to break down to release the glucose in the blood that the body can make use of. So that is why it is advisable to use the complex carbohydrate than the simple carbohydrate. Complex carbohydrates such as the wheat, whole wheat, guinea corn, wheat, and so on and so forth. These are the complex carbohydrates. So, but contrary to that, if you use simple carbohydrate, it is easy for the glucose unit to be broken down in the blood and then to release the energy. It will be much available in the blood, which the blood, remember that the issues it has to do with the glucose control level within the system, and as such, so availability of it will be disturbing the patient since there is the release of the glucose within the system. So as such, it is not advisable to make use of a simple carbohydrate so as to have a slow digestion. Number two, with regard to the issue of what to eat, so you look at the protein intake. Although every individual there's a recommended intake of the protein or carbohydrate or whatever class of food supposed to, even though you are suffering from the same type of condition, because the body composition matters, gender matters, and the state of health condition matters. The degree of the concentration of the blood glucose level in the system, it also matters. So there are different way we in which we recommend the levels of the food intake that can be used by the patient. So, and it is very important to consult, always to consult a professional, that is the nutritionist, to know what is the diet menu plan that you can make use of so as to stay healthy. Then, looking at the protein, it is advisable to make use of a lean meat because meat that are lean contain less fat, and therefore it is more better to make use of lean meat that have less amount of the fat in them, and also to make use of proteinous plants like the legumes and pulses. All these, especially the kidney beans, it contain a less glycemic index. That reminds me, even the carbohydrates, when you are considering the carbohydrate intake, the patient should supposed to make use of a low glycemic carbohydrate. That means carbohydrate uh, that have a less glucose level compared to others, because of the response of the insulin is dependent on the glycemic index. So food or carbohydrate that are less in glycemic index is more recommended for a diabetic patient than those that are having high glycemic index. So also with respect to the meat, you can also make use of skinless meat or poultry. That's because most of the uh, most of the skin of the poultry contain high amount of the lipid, and as such, if you remove it to become skinless, therefore you remove the lipid layer or the fat of it, and then you can make use of the protein. It is also recommended. Then talking about the fruit and vegetables, it is less in caloric. It is a low caloric food substances that is more better for the for the diabetic patient, and it is highly recommended to make use of the fruit and vegetable, because of fruit and vegetable contain high amount of antioxidant, and this can also help in preventing heart related diseases because of the level of the antioxidant that are present in them. Then there is also issues of lipid or fat. People suffering from diabetic condition are advised to make use of unsaturated fat because of it is more healthy fat than saturated fatty acid. So, and as such, it is best to use unsaturated fat such as sunflower fat, corn oil, soybean oil, olive oil, among others. These are the best food that they can make use of as the source of the fat, because of fat contain high amount of energy or calorie, and it is good to use the healthy fat so as to avoid the risk of this condition.